Well, health matters in South Africa's health system once again under severe scrutiny. The World Health Organization is warning if there's an epidemic in this country, it would result in unnecessary deaths. It's released a report, and in it, it says lawmakers are wasting time in approving legislation to prevent a very serious health situation. My colleague Erin Bates has been following that for us, joins us here on the show. Erin, hello to you. Just how bad is this?
It's really bad, but it's been couched in very diplomatic language. So this report from the World Health Organization says in not so many words, there's been a delay on two very crucial health bills that are standing before Parliament. One of them dates back to 2005, the other is from last year, and they both concern international health regulation standards, which South Africa has agreed to meet. So they've done an assessment of about 48 different technical areas in healthcare, and our ability to deal with the epidemic, they say, is absolutely atrocious. Not in so many words, but our rating on that is the lowest, it's the poorest in this report.
And so I imagine on a scale, a sliding scale of concerns and seriousness, where are their focuses as far as concerns are concerned? Because there's a lot they've got to deal with, but there are priority concerns, I'm sure.
There are. What is interesting about this report is that for the most part, the technical areas they've assessed, we've done quite well in. So we do sort of average, above average, or excellent. So it's not all bad news. There are some areas in which the South African healthcare service and system is very good. So looking, for example, at immunization, our National Institute of Communicable Diseases, our laboratory facilities and so forth, those are very strong. But something like epidemics is a great concern, and also the lack of this legislation, which will help in terms of providing budget, but also a benchmark for any health policy and implementation going forward.
I think the obvious question many people are asking today is, why is this a problem that has gotten to this kind of level? What has happened, or perhaps not happened, that has led to this kind of concern?
Yeah, well, the World Health Organization, again, kind of sticking with its diplomatic tone, hasn't really veered into that too much. And in fact, in their report, they praise South African healthcare workers for their participation in the report and its research. But Wilmot James, who some people may remember was once an MP for the DA, now works at Columbia University dealing with public health and policy, has written a piece in the Daily Maverick this week, and he points the finger very strictly and sternly at the Speaker in Parliament, Erin Bates, and the head of the Portfolio Committee on Healthcare, asking why have these two bills stalled? Why are they sitting at National Assembly and not being passed through? And this happens within the context of the listeriosis outbreak, scrutiny over the public healthcare sector in the Northwest for this week as well, where we've seen those incredibly violent protests, and questions around, one, policy, because policy exists and in many cases is quite good, but also implementation at a municipal level, at a national level. Are we implementing our policy in healthcare to provide the services we need to?
A little earlier you mentioned these two bills that need to be fast-tracked. When it comes to politics, the word fast is used rather loosely. As a final question to you, Erin, where are we on the fast-tracking of these bills? What's our timeline, or the sense that you're getting of that?
I'm afraid I don't know, Gareth. I wish I could look into a crystal ball for you and say. All we know is that they're sitting at National Assembly. There are two more steps in the process, which the Parliamentary Monitoring Group is busy monitoring, and they have details on these two bills on their website. But there's no indication that between that bill from 2005, which concerns the international health regulation standards, and a more recent bill on South African healthcare from 2017, that there's any progress, that they've moved in any way forward. So it's really up to the Portfolio Committee to answer that question.
Yeah, it really is, and hopefully we're going to investigate that further. Erin Bates, thank you very much. And a very complicated story. If you've missed part of it, this will be on our YouTube channel a little bit later, and you can look out for Erin's report here on eNCA.